Thank you. You stand there and you think, that's just something I've done. It's not who I am. But the more education we get and the more they learn, we change the who I am. Now, I want to do two things for you this afternoon. Those of you who have known me for, what did she say, a quarter of a century, know that I'm always looking for new ways to present health information because one way doesn't get everybody. So I have some dear friends who have 10 parrots. I asked them what they thought they were doing because those parrots are going to outlive them. They can live up to 70 years, in captivity. But anyway, they've got these 10 parrots. Birds are the fourth most common pet in the United States. So I thought, what if they would let us go film their birds, and then we write a little script to go with that about brain function? And they said, sure, we'll do that. So we just finished filming 12 segments. They're just like 5 minutes long. We're going to put them up on YouTube free, let anybody look at them and use them who wants to. And I thought it would be really fun, at least for me, to show you one of them. So let's start by looking at one of the Birds and Brains series.
Now it's time for Birds and Brains with your host, Quentin Quill, and special guest, Dr. Aviari, and live via satellite, brain function specialist, Dr. Arlene R. Taylor. Here's Quentin.
Oh my!
They must be crazy about us.
Or maybe just plain crazy. Hello, and welcome to Birds and Brains, where we talk about amazing and fascinating facts about birds and, excuse me, and human brains. I crack up every time I say human brains. I'm Quentin Quill, a rose-breasted cockatoo and host. Being the intelligent bird that I am, I oft ponder the oddities and curiosities, the differences and similarities and the uniqueness of bird brains and the brains of humans.
There he goes again!
Oh, that's so funny to me. Oh yes, I forgot to introduce you to Clifford, an African gray. Say hi, Clifford.
Hi, Clifford.
We're here in jolly old London, and I'm so happy to welcome avian researcher and a most attractive green-winged macaw, Dr. Aviari. Glad to have you here, Dr. Aviari. Let's fly right into the topic. Now, I'm told that humans use the, quote, bird brains as an insult.
Imagine that!
Typically, bird brains are dense with tiny, tightly packed neurons. Songbirds and parrots, for instance, have more neurons than even primate brains of similar mass. Avian brains thus have the potential to provide much higher cognitive power per unit of mass than do mammalian brains. Some parrots are capable of cognitive feats comparable to those of great apes.
Are you mammals listening? Dr. Aviari is not monkeying around.
That one cute.
You see, the palladium in birds corresponds to the cerebrum in human brains. This means that fowl, perhaps with the exception of seagulls and domesticated turkeys, have the potential for much higher cognitive power per unit of mass than do most mammals. And cockatoos, ravens, jays, macaws, and crows are believed to be extremely intelligent.
That explains so much. But speaking of fowl,
Don't go there!
I've read somewhere that these same birds can think and problem solve at the same level as an average 7-year-old human. How do you explain that?
Research says that intelligence is not always related to the number of neurons, but how densely connected they are with other neurons.
Interesting.
Einstein is said to have had a relatively small brain, but mega connections among neurons was absolutely off the charts. Having said that...
Having said what?
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 They have a fabulous prefrontal cortex. And believe it or not, some humans seem to exhibit lower levels of cognitive function due to the lack of use than do some fowls.
Foul? Foul? Did I hear someone say foul?
Stop it, Quentin!
Some birds can make and even use tools. They have an amazing built-in GPS for directional finding, which is essential during migration. Recent studies have suggested that homing pigeons use infrasounds to help them navigate back home. Sound outside the range of hearing for humans, but which they can often sense or feel.
Is that why birds of a feather migrate together? As you were saying, good doctor.
Birds can problem solve, make inferences about cause and effect, plan their future needs, and evidence other cognitive skills formerly thought to occur only in mammals. Crows have been found to pass on cellular memories to their offspring. Typically, fowl have a positive mindset unless they are sleep deprived, sick, or wounded. They sing and whistle and chirp to keep their spirits up as well as those of their friends. When a bird stops communicating through sound, likely something is very wrong.
Good point. I've heard Dr. Taylor say that everything begins in the brain, and it starts with a mindset. If you think you can, or you think you can't, you're right.
Yes, and in humans, it goes something like this. Thoughts create mindset, which determines self-talk, which drive actions and behaviors, which influence how healthy you are, and which impact your longevity.
Interesting.
Brain scans have shown that humans may communicate best with its brain by talking to it, as if it is a separate entity. Dr. Taylor said to start with your given name so the brain knows who you are talking with. Then use the pronoun you, followed by positive words in the present tense. Only tell your brain what you want to have happen as if it's already happening. If your brain thinks that now is the time, then it will immediately react.
I think that I have this self-talk down. Check this out. Quentin, you are a gorgeously fabulous rose-breasted cockatoo. Quentin, there are no words, simply no words.
Well, in principle, you got it. Affirmation is said to be the programming language of the subconscious in humans, maybe in bird brains as well, but I don't know.
Very informative. Now it's time to bring my favorite brain on the planet, and the only human I can tolerate, Dr. Arlene Taylor. Hello, Doctor.
Hi, Quentin.
I like your new jacket. It's rose-colored.
In fact, it is.
We have so much in common. Dr. Aviari and I have been chatting about bird brains versus human brains. And as you know, we film on location, which means tons of travel. How does travel impact the brain?
Travel is considered a stimulating anti-aging strategy for humans because it challenges their brains with new sights, sounds, smells, tastes, topography, music, people, customs, and animals. Travel can be local, national, or international. The brain thrives on variety and new experiences.
Dr. Taylor, any comments on neurons in bird brains versus those in humans?
One study showed that a cockatoo brain weighs about 10 grams with up to 3 billion neurons. An adult human brain weighs in about 1,200 grams, but it's not nearly so densely packed with neurons. Estimates are there are about 86 billion neurons in the cerebrum, or gray matter, and another 16 billion in the cerebellum.
That's a respectable number of neurons, especially if the humans are using them. Well, that brings us to the end of today's program. Thanks to Dr. Aviari. And to my favorite brain function specialist, Dr. Arlene Taylor.
Thanks, Clinton.
Until next time, this is Clinton Quill from Birds and Brains, wishing you a positive mindset and empowering self-talk. Say goodbye, Clifford.
Goodbye, Clifford.
So, what do you think? Did you like that? We're experimenting. And I think it's going to be fun. So you can go to my website, to YouTube, and you can start seeing some of the things that we're posting. All right. My topic today was assigned to be. You know, sometimes I'm just asked to speak, and somebody says, talk about whatever you want to. Well, I'm sure you know that Greg and his wife had an interesting experience not too long ago with a potential for a medical injury. So he asked if I would talk about that today, so I'm happy to do that. I spent years of my life as a compliance officer and as a risk manager, and it was involved with medical injuries and medical errors. So let's see where we go with this. Got it. All right, so how would you define a medical injury? A procedure being done improperly, that could result in a major medical injury. Anybody else? The wrong medication. Yes, you're supposed to get one thing and they gave you something else. What? Sometimes they don't screw it in right. What can I say? I guess surgeons can't do everything flawlessly. So, here's the medical definition. Harm or death related to a medical error. It's often described in two ways: serious harm or lethal harm. Now, what does lethal harm mean? It means you got a high risk of kicking the bucket because of what happened. So, the complications from these medical injuries can be very mild, and the medical team is able to help you overcome them. It can require more hospitalization, extended sometimes, and it may require additional medical care. And the problem is that doctors are human beings. It is an inexact science. We often go to a medical professional and expect that he or she knows exactly about our body and what needs to happen to make it better. And they don't. It's their best guess. But like every profession, there are some perhaps who are less careful than we would like them to be. And the worst outcome, of course, is you die. So how often do we see medical errors? Johns Hopkins in 2018 did a study on what they defined as medical errors, and they're estimating that more than 250,000 people a year, that's 250,000, die from medical errors. But then other studies came along and said, that's not even close to what's really happening. They've got it up there around 440,000 a year. So in terms of deaths in the United States, medical errors are the third leading cause of death. Did you know that? That's pretty high. They're after heart disease and cancer. Third leading cause of death. I do not want to be a medical statistic. So here's some examples of medical errors. Errors of commission. That means they did something and they made a mistake. Or errors of omission. They were supposed to do something and somehow they didn't get the job done. And now there's a problem. Errors of communication. Have you heard the joke that doctors can't write legibly? Well, some of them can, but even with computers, there are errors of communication. And sometimes the error is one person was supposed to pass on some information to another member of the team, and they didn't do that. Or they passed on the information, but they didn't have it right. And so it's like that old game of telephone. Did you ever play that when you were kids? I would get hysterically amused with that. You start out with something really simple. You know, you whisper it to the next person, and then by the time it gets to the 20th or 30th person, you ask them, what was the message? It's got nothing to do with the message that they started with, because everything is filtered through human brains. And it's filtered through our past experience and how much education we have, and on and on. Errors of context. You go to a medical professional, and in today's world, you know, they want everybody to see a new patient about every 10 or 15 minutes. So they rush and they make their best guess, but they really didn't hear what the patient was saying. And that can sometimes majorly impact not only the diagnosis, but the treatment. For example, somebody comes in and the doctor says, I think it's this, here's a prescription, go fill it. And the patient absolutely cannot afford to fill a prescription for that very expensive medication, but doesn't say anything, or if it is said, the medical professional doesn't hear it, so they never fill the prescription. And so they don't even know if they would have had any benefit from that medication. And then diagnostic errors. Failure to make an accurate diagnosis, and I would suggest that needs to also say in a timely manner. Because sometimes it can take literally years for someone to get the right diagnosis and the right treatment. And the two glaring things we see in today's world are chronic fatigue syndrome, which, I don't know, 90% of the medical community said does not even exist. Excuse me? And Lyme disease, which they also said it's all in your head. Well, a lot of it is in your head because of the disease, but it definitely does exist. So that's the kind of thing we're talking about. Now let's talk about harm, because sometimes you really don't get any harm, and sometimes you do in the short term, and sometimes in the long term, and sometimes it kills you. So immediate harm, let's say that they gave you too much anticoagulant, too much of the rat poison, Coumadin, too much of whatever they've got to give at the moment. And then you've got harm that doesn't show up right away. It'll show up in weeks or months later. And that's the big thing about being really careful to sterilize needles and to wear gloves and not cross-contaminate anything, because you might get stuck with a needle that had not been sterilized yet because somebody put it in the wrong place, and then you come down with hepatitis C a year later or something like that. And then there's harm that occurs many years later. So, for example, patient had a splenectomy, and the current medical advice, practice, is that they need to be vaccinated against pneumococcal pneumonia if you've had your spleen removed. But somehow that's missed, and they don't get that immunization, and then they are in real trouble when they get a serious case of pneumococcal pneumonia. Now, how about documentation of you and your health and your care in the medical record? Well, in a study that broke past the wall of silence, as it's called, about the discovery of medical errors that were missing from the medical record, the researchers found that 6 to 12 months after the patient got discharged from care, often from the hospital, they could recall 3 times as many serious, preventable adverse events or errors as were reflected in the medical record. Now that's a problem, because if somebody has a really bad side effect, and let's say they sue so that they can get better coverage for their treatment that's going to be ongoing, the company will probably say, send us the medical record. We want to see what really happened. All right, if nobody documented it in the medical record, that's going to be really hard for the patient to prove that it really did happen, and what they're suffering from now could be traced back to that cause. Even for those harms that were identified in the medical records of Medicare patients, only 14% became part of the hospital's incident reporting system. So one of my jobs as a risk manager and compliance officer was to stay really alert, and if I became aware of something, go see if it's in the medical record, number 1, and number 2, fill out an incident report, so that if the patient has something happen untoward, there's some documentation that will give them some backing. Physicians really do the best they can. I've had some wonderful experiences with fabulous physicians. I'm the proud owner of about 8 pounds of titanium between my 2 replacement hips. And the surgeon who put those in was absolutely marvelous. One of the risks of hip surgery is that one of your legs will be a different length from the other one. You know that, because it's pretty hard to figure that out. This guy has that down to a science. He even developed some equipment to measure the legs of the patient while you're in surgery. And he guarantees that I have a 1/100th of an inch difference between the length of my 2 legs. I can live with that. But I'm sure you've seen people walking around with a big lift on one of their shoes, and that's an attempt to, get the legs the same length. So just like every profession, there's some people who are absolutely gifted, and there's some who have good skills, and there's some probably who went into the profession for reasons that didn't match what their brain did well. And it just happens. Okay, now, let's talk briefly about what your risks are. Nature plus nurture equals you. I'm sure you've heard that. So nature is genetics, the genes and the chromosomes that you got from your biological egg and sperm donors. Everything to do with genetics accounts for about 30% of your health and your longevity. Now, 30% is 30%, but 30% is only 30%. So when you figure everything out, epigenetics has far more to do with how well you are and how long you live than genetics. So nature involves epigenetics, and epi, E-M-I, means above genetics. Here's the marvelous news that we have from research. Epigenetics accounts for 70% of how well you are and how long you live. And it can, in some cases, even override genetics. So I didn't choose my parents. I'm not saying I wouldn't have chosen them, but I didn't. So 30% of who I am is a done deal. And my 2 hips are part of that 30%. Because scoliosis syndrome runs in my father's family. What a pity, he was my favorite parent. Now, when I was little, if people had understood scoliosis, they would have been able to put me in a back brace, and I would have been a little less crooked. But it's okay. I'm so, I don't like being like everybody else anyway, so what's a little bit more? But that I can't do anything about now. It's too late. There's nothing they can do about making the bones straighter. But I can do everything. I can compensate with that 70%, which includes being as healthy as I can and exercising and eating right. And I think, Greg, drinking hydrogen water. When I travel, I can't take my machine with me because I only have check-in luggage. I have no check-in luggage. I only have hand-carried luggage. They've lost my luggage too many times. When I get home, let's say after a 5-week trip to Australia, New Zealand or something, I walk in the house and I turn on my hydrogen water machine. And I tell you, I drink that glass of water down, and in 5 minutes, I literally feel differently than I have over the last few weeks. So for me, that is number 1. I will not be without a hydrogen machine. And if PG&E doesn't get their act together and quit turning off the electricity at my house, I'm going to have to get a generator. Because it's not fun to have the electricity turned off in the hope that maybe they'll prevent a fire. I'm sure they're doing about the best they can, but this year it hasn't been good enough because I had to evacuate from my house 3 times. Not from fire, not from smoke, but because for a whole week there was no electricity. What can I say? All right. So how do you avoid medical injury? Well, bottom line, you can't avoid everything. You absolutely cannot avoid everything because we can't control very much. Researchers say about the only thing you can control for sure is this. When you realize that you're thinking a thought inside your brain, you have a choice. Do you keep thinking that thought and act on it? Or do you think a different thought and take a different action? And that right there will impact the 70% that decides how well you are and how long you live. So, a lot of your interaction with healthcare professionals will be positive or negative depending on how much you understand. Have they taken time to explain this to you? Do you know what the data means? When they hand you a report, do you have any idea what that means? Or do your eyes just glaze over and you say, okay, doc, just whatever you order, I'll take? Do you know how your body acts to medications? Are you comfortable enough saying, like me, when I was in nursing school, I didn't know anything about balance in life. I worked night shifts and went to school all day and grabbed food when I could, and I got a horrible strep throat. Out of school for a whole week. That's a long time. They gave me penicillin. I had a horrible penicillin reaction. Horrible. Rash all over my body. Couldn't, teeth chattering, couldn't put 2 words together logically. Well, not many times since then, because that started me on a personal journey to health, and I don't know why it took Greg so long to get impacts going, because it would have been easier and faster if he'd gotten on the ball sooner, but I did my best. So occasionally something has happened and they want to give me an antibiotic again, and I'm really clear. If it has any penicillin or derivative from penicillin, I will not take it. So you have to know to the best of your ability how your body responds and be willing to talk about it. But you can minimize the risk by doing several things. For example, what do you know about your ancestors? Now, if you're adopted, you probably may not know much about your ancestors. But there is Ancestry.com now and some other programs where people are finding relatives that they never knew they had. I have a wonderful little second cousin. Oh, he's not so little now. I think he just turned 42. But, when you've known him from babyhood, I call him my little cousin, he knew zero about his biological family. But he had his, saliva done or whatever, sent it into Ancestry.com, and he got a call last week from someone who says, I think I'm your uncle. And he's having a wonderful time communicating with his uncle. His uncle isn't sure whether his biological father will want to meet him or not because he was a bit of a rounder. And he probably had no idea this one-night stand would end up, with this lovely young man. But anyway, how much do you know? Ask questions before all the people who know about the last 2 generations are dead. If I'd realized this, I would have asked lots more questions. Not to try to find blame, but to learn. So, if you know, for example, that scoliosis runs in this family line and you have a baby, the first thing I would do is have him checked for scoliosis, and so on. Create and maintain a longevity lifestyle. There's so much that can be prevented. And even when you didn't or couldn't prevent something, there are often things that you can do to moderate the symptoms and the outcome. And hydrogen water is one for me. People always want to know what I take, and I don't know why, because what I take may not have anything to do with your body. But hydrogen water is key. I've been taking Enterprime since this company was launched. I carry it with me all around the world. And because the bottles take up a lot of room in my suitcase, and I got to take enough for 6 weeks, I dumped it into a plastic bag, put it in my suitcase. Well, they wanted to check my suitcase. And they pulled out this bag, and they said, "What is this?" I said, "That's my green stuff that's going to keep me alive overseas." "Well, how do we know what it is?" I said, "I'm telling you what it is." And they said, "All right, eat some of this." I said, "Fine." Opened the bag, licked my finger, put some in my mouth, and said, "I like it better in water, but this is okay." And so they passed it. I don't know what I'd have done if they took it away from me. And Delta E, I love Delta E because of L-theanine, which our brains begin to lose. The levels fall as we get older, and that's what helps you think clearly. So I have to be careful when I take it because I am very sensitive to any caffeine. And caffeine has a half-life, between 6 and 12 hours. So early morning, first thing when I get up is my Delta E time. Because I want to sleep really well at night. And if you are really sensitive, sometimes it can keep you awake a bit, but that stuff is great. So how does your body feel when you have lots of energy and you feel good and you're enthusiastic and you just can't wait to do what you do? And do you know quickly how your body changes when it's not feeling so good and it doesn't have so much energy and it doesn't want you to get going too quickly? Pay attention when something doesn't feel right. You are not I'm not advocating you be a hypochondriac and, like the guy that came in one day to the ER and he says, my knee hurts really badly. So they did x-rays, they did an MRI, looked like a perfectly healthy knee. And they said, well, what's the problem with your knee? I don't know, it just aches. I think I have nursemaid's knee. That's not a diagnosis. Don't know where that came from. But pay attention and be wise about going to be seen if you need to, so you can catch something quickly. That's one of the problems that some of the people are having with the coronavirus, which is a little scary. They think they're just getting a slight cold or a flu and it'll pass in a day or two. And they don't go and get seen, and especially if they're very young or very old, by the time they go, that virus has such a hold on the body. And of course, antibiotics have no effect on viruses whatsoever, because viruses go inside the cell, and it's too late, and they just can't, and they succumb. Be realistic about your expectations. Somebody said to me the other day, they read the little book I wrote, Longevity Lifestyle Matters, Just the Facts. And they said, if I do everything in here, will I stay well until I'm 120? I thought, I really need to have a chat with them about the brain. You can't prevent everything, but you can prevent a lot. So the goal is to learn the research, choose to implement it, and prevent what you can. Shop for a healthcare professional who listens to you. And sometimes people who've seen the same people over and over again for years don't want to make them feel bad by getting a second opinion. Get a second opinion, get a third opinion, get whatever number you need to find out what's going on with you, because nobody can know everything. Take an advocate with you. They can listen to what the doctor or the healthcare professional tells you. You won't hear everything. That's what we heard this morning. Adults need to hear things 3 or 4 times before they really get it. And so you're in this conference and, the doctor is rattling off these instructions. You will not hear and remember all of them. Take somebody with you. And sometimes if you're a little timid, they can advocate for you. They can say, wait a minute, doc. I don't like the sound of that. Let's talk about this a little bit. Whereas if there was no advocate with you, you might not even be feeling well enough to ask the doctor, okay, say that again because I didn't get it. So take an advocate. Ask questions. Okay, we're going to try a new medication. All right, can you tell me the most common side effects? Because there's some medications I will not take because of the side effects. In fact, the other day, I do not take hormone replacement therapy. I personally do not do that because of my study of the research. But the other day, one of the healthcare professionals said, there's some new estrogen out that doesn't seem to have the side effects, and it'll help your hair grow. I've always had really silk fine hair. I thought, well, okay, I'll try it. I said, what are the side effects? Oh, I don't think there are many side effects, but I'll give you some literature, you can read it. So I went home. The 3rd day of taking this medication, I started to cough and continually clear my throat. And I thought, okay, this is strange. I can't afford this. I lecture all the time. So I went and found the package. Thank the Lord I hadn't thrown it out. And I turned to the section that says complications or symptoms. And what do you think number 1 was? Cough and hoarseness. My bad, I should have read it first. But I read it then, and I called up and I said, I'm just telling you I'm stopping this medication because I've got a cough and my voice is getting, raspy, and I can't afford that. Well, then I triggered a whole investigation. People kept calling me from, CDC, other places, about the medication, because if too many people report the same symptom, they'll pull it off from the market. So pay attention to that. So the bottom line is, you're the only person who's going to be with you for your entire life. You are the only person who can do it for you. You are the only person who can take care of your body like you want it taken care of, as long as you're mentally fit, and a longevity lifestyle will hopefully help you stay mentally fit longer. Never, ever hesitate to get a second opinion or a third opinion. And change practitioners. And if you do have a medical injury, there is no shame in consulting an attorney about that, because if it's going to cost you a lot of money to recover from, your insurance might not handle that well, and you might need a little bit more. So, you are unique. There's no two brains or two bodies on the planet identical, not even the brains and bodies of identical so-called twins. Who you are in terms of health, wellness, and longevity is this complex interaction between genetics, epigenetics, your brain, your spinal cord, all your body organs, the microbiome and the virome, all the little bacteria and viruses that live inside your body, and many of them are good, and without them you would be in bad shape, and there are some that are not so good. I love what William Faulkner said. The past is never dead. It's not even past. You carry it within you, and you do that with your cellular memory from ancestors 3 or 4 generations back, from all of the choices you have made, from what you eat, from how much you sleep, and all of those longevity factors. And be wise about how you deal with it. Because if you don't do it, who will? Thank you.